Hi everyone, Dr. Orna Isaacson here. I wanted to come on today and talk a little bit about what we know and what we don't know about herbal medicine in terms of the current COVID-19 coronavirus pandemic. The bottom line is that this virus, COVID-19, is brand new. And that means that there aren't randomized placebo-controlled clinical trials in humans to see what herbs do what to help prevent, treat, or cure this disease. So right now, herbalists and naturopathic doctors are being super careful about what we say because people are getting shut down for making medicinal claims. Now, what we do know, there's some reports coming out of China that are giving us some ideas of herbs that have been useful over there. I am not aware of any of that information coming out of Italy or other places yet. What we do know about herbs is how we think they work based on studies in petri dishes and in laboratories, and fewer studies on humans. So I just want to caution that anybody who says this herb treats coronavirus, COVID-19 specifically, we don't know that. What we do know is we're getting a better picture of the physiology of this disease and the pathophysiology of this disease. We're getting a better idea of how it spreads and the mechanisms that it uses to infect human hosts. And we do have a decent understanding of the mechanisms that many herbs use, the mechanisms that allow many herbs to work on viruses in general. We do have information about how many herbs work in terms of human physiology. And then we have some ideas about the mechanisms that they use and how those might be applicable given what we know about the mechanisms of COVID-19. So, all of that is to say, we are still figuring things out in terms of clinical experience with herbs and this disease. So I want to give a shout out to my herbalist colleagues and my naturopathic colleagues. A lot of people are going back and forth sharing experiences right now, sharing research right now. I'm in a couple of groups where people are saying, I'm seeing patients whose pictures fit the COVID-19 picture because we don't have enough testing to know for sure who's got it. So people are saying, this is what I'm seeing in my clients and my patients. This is what we're doing. This is what is helping. We're getting those reports of people who are helping support people who are sick, and we're getting those reports from people who are themselves sick. So I can't purport to say that any particular herb prevents, treats, or cures COVID-19, but there are some things that we know. So I've gotten a lot of questions about elderberry. And elderberry is kind of controversial right now because based on what we know about how it works mechanistically, it does raise some of the chemical messengers in the body that cause inflammation, increase inflammation, and are associated with cytokine storm, which is the worst outcome and the thing that kills people with COVID-19 and other similar respiratory viruses. Basically, cytokine storm is when the immune system becomes dysregulated and just starts screaming all the time, and it starts to liquefy tissues, and obviously that's not a thing that we want. Now, cytokine storm is something that we generally only see in very late stage disease. Some people have experienced it earlier on, not to scare you, but that can be a thing. Usually it is not herbs that cause this. Usually it is dysregulation of the person's immune system that causes this. So I'm not generally concerned that an herb is going to suddenly bring on cytokine storm. Now, the issue with elderberry is that it does have compounds that in lab experiments, not in humans, have been shown to increase the cytokines that can lead to cytokine storm. There are other mechanisms of action for elderberry as well. And some of those mechanisms actually calm runaway inflammation. There also are some things that elderberry does that have been shown to help prevent the viruses in general from attaching to human hosts, so preventing infection in the first place. Now, the information about that was not done with COVID-19. It was done with several kinds of influenza and shown to be effective there. And it was shown to be effective by slightly different mechanisms on other coronaviruses. This doesn't tell us that elderberry will prevent, treat, or cure coronavirus. It doesn't tell us that. But similarly, we don't know that it would exacerbate or worsen COVID-19. We just don't know. So there are people who have autoimmune diseases or have sort of twitchy immune systems in general who find that elderberry does not work for them. From what I've gathered from the experience of people that I've spoken with who are in that category, they kind of know pretty quickly. I have one colleague who is sick, possibly with COVID-19. She was taking elderberry and kept not getting better and not getting better. And then she switched the elderberry out for some other herbs and immediately felt relief. So what I'm telling people is, I personally, for myself, am taking a little bit of elderberry daily as a preventive. I'm also doing all the things like washing my hands, trying not to touch my face. My hands are in my pockets right now. And going out as little as possible. Those are the things that we know for sure help reduce the risk of contracting this disease. What I'm telling my patients is if they are interested in trying elderberry syrup, they should basically watch out to see if they feel worse at all. And if they feel worse, I am telling them to discontinue it. There are many, many herbs that theoretically can be helpful at this time. Elderberry is popular, it tastes good, it's generally been accessible, although it's getting harder to come by now because people are scared, and there's reason to be scared now. But elderberry is not for everyone. If it is not for you, just stop taking it. So that's kind of my take on that. The last thing that I want to talk about right now is what I said a minute ago. The things that we know are effective are social distancing, and I should rephrase that, physical distancing, staying away from other people, which doesn't mean, in real life, staying away from other people, which doesn't mean not being in communication with people. Washing your hands, limiting touching your face. All of those things are really important, and we know that they work. So I hope that you are staying inside or away from other people as much as you are able. Stress is real right now. One of the things that I'm doing to help combat my own stress is I am going for walks. It's been pretty sunny here. And because I am an extrovert and social distancing is hard for me, I am doing some of these walks live on Facebook and on Instagram, and I will post everywhere when I'm doing them so that you know about it, and you are very, very welcome to join me. The idea is that being out in nature helps reduce stress, improve mood, and it does help support our immune systems. So getting outside but away from people, especially if it's sunny and warm where you are, is generally speaking a good thing to do. And I hope that you will join me. I hope that you are staying safe and well. And thank you for paying attention to this and taking this pandemic seriously. And I hope we all stay as safe as houses.